bit of a delay on the update post-surgery. A lot was going on. I was moving apartments, I had a few essays due for university, and then I inevitably got COVID, but we're all good now. So, last video we spoke about, I think it was up to 3 weeks post-surgery. I remember speaking about the contact lens coming out, the bandage contact lens after the transplant, and the medical regimen was every 2 hours, the corticosteroid eye drop to prevent the rejection of the cornea, and then the antibiotic eye drops every 2 hours, and then also the artificial tears for moisturizing the eyes. So after about 3 weeks post-surgery, I got told stop using the antibiotics, and then I saw the doctor 1 month post-surgery, and he said now you need to reduce the corticosteroid to 4 times a day, and you also have the artificial tears 4 times a day. So that month, how's it been? So 1 month to 8 weeks. It's been relatively pain-free. The main issue has been that I do get the grit in the eye type of feeling sometimes, which is when the stitches get kind of dry, so the eye is dry, and it feels like there's sand in my eye or something. But yeah, it's been pain-free for the most part, and the doctor did say I could start working out again as long as the intensity was low enough for me to still have a conversation. He said it's okay. But then I got COVID, so I didn't work out. And yeah, the COVID as well didn't really affect the eye, which was a good thing, because conjunctivitis is one of the symptoms of COVID, which I did kind of get in my right eye, the healthier one, which yeah. But the left eye, the one with the new cornea, is fine, so we're good. So I saw my doctor a week ago now for the 8-week post-op checkup, and the only issue that's happened in that last month between seeing him is that the vision felt a bit more blurry. So my left eye, from the first day the bandage come off, it has been clearer than before the cornea transplant. However, it kind of gone a bit blurry compared to that initial plus that we had with the eyes. So I mentioned this to him, and he believes it was down to the pressure, because he measured the pressure of the eye as well. So I've been given an additional drop now, which I use twice a day for the next 2 weeks. So I'll see him 2 weeks post last appointment. But I need to use this to reduce the pressure in my eye. And you know what? For about 3 hours after using these eye drops, my eyes do feel clearer in their field of vision. And also the corticosteroids have now been reduced to 3 times a day. So as soon as I wake up, and then every 8 hours, I try to space it out as evenly as I can. And then the artificial tears still 4 times a day. Need them, you definitely need them. And then he then said to me about any questions. Now the question I did have is, I did want to go swimming, and I had to try a few goggles on a few days before I went to see him, and I just felt like there was pressure being built up in my eyes when I put them on. But he said to me it's perfectly safe to wear swimming goggles as long as they're not touching your eye. So I did get some goggles which have a decent enough space around them, and I did go for swimming, and it felt great, you know, being in the water. Still haven't been able to lift weights in the gym. Like, I have a kid who is about 10 kilograms right now, and if I'm holding him long enough, I do feel a bit of a pressure build up in my eye at that point. So yeah, weightlifting is definitely out the equation for a while, but I do need to start lifting light, I think. He has said it's okay to do so. I just can't do anything where I am face parallel to the floor. So things like, yeah, barbell row, for example, will be out the equation, as will press ups. But yeah, I will do an update after I've seen my doctor on the 2 weeks post-op, so that'll be 10 weeks post-op rather. 2 weeks from when I last saw him, just to give an update on how it's going. But you know what, it's largely pain-free. I am allowed to get water on my face again as well. So I've been washing my face in a very methodical manner, so it's great just to be able to throw water around again. So yeah, next update definitely 2 or 3 weeks time, and hopefully I can report that I've been working out again. Let's see how it goes.